So really my work is a small part. This is the real team that did it all, Spiros, Sophie and Rafa. And we were really grateful for the BBS for supporting this funding application. Next slide. The reason we did it is because we know that the healthcare for adults with OI and even children with OI can be considered as fragmented. And as plans are put in place to better coordinate the care and improve outcomes, one thing the NHS policymakers will be looking at is that if you do things better, does that improve how well the money's used in the NHS? And to do this, we need to understand how people are using NHS services right now. Next slide. So we had 2 research questions, and we've only so far answered the first one. The second one's still ongoing. The first one is, what sort of admissions are being done by people with osteogenesis imperfecta across the life course? How often are they going to hospital to be admitted? Next slide. So to answer this question, every hospital, when a patient's admitted, sends the diagnosis code and the cost code to central bodies in England. So we have within England every hospital admission. So we had access to this data for 4 years from 2014 to 2018. And there's a coding system called ICD-10, and there's a specific code for osteogenesis imperfecta. It doesn't tell us what type of osteogenesis imperfecta, how severe, but it does hopefully pull out people with this diagnosis. And then we looked at the number of admissions, and admissions can be planned, and we call those elective admissions, or unplanned, and we call those non-elective admissions. We looked at the number of patients, lengths of stay, and the overall costs. Next slide. So here's the information. So over 4 years, there were 16,000 admissions for people with the diagnosis of osteogenesis imperfecta. This includes both planned and unplanned, and just over half of them were in the first 14 years of life. And over the 4 years, it was about £24 million worth just in admission costs. So we now have an idea of how much OI costs the NHS. Next slide. We were able over the 4 years to look at time trends, and we could see that over time admissions are increasing at around 2% per year, whereas the number of people is also going up even at a higher rate at 6.4% per year. Next slide. One of the major limitations is we didn't have access to individual patient records. We couldn't confirm the severity of osteogenesis imperfecta or whether there were other reasons for admission. Importantly, we didn't also have access to emergency room or outpatient contact details. The NHS data system is really not geared for that. Most of these contacts are not actually coded very well, and so we wouldn't have been able to find people with OI using those methods. And then finally, we couldn't look at any regional variation. There are any differences in the northeast, northwest, and the analysis was restricted to England. Next slide. So we had 16,000 admissions between the 4 years. The admission costs, it should be 6 million, not 6 billion. If we were, I don't think NHS could afford 6 billion. The 6 million pounds worth of just admission costs a year, and they're increasing at a rate of 2%. And so it puts some guide to the impact of people with OI on NHS care use, and then gives us scope to see how better coordinated care may reduce these costs. Next slide. So I'd like to acknowledge Spiros, Sophie, and especially Rafa, who really led this research, and the Brittle Bone Society for their support. And final slide. And as I said, we're doing more work to examine patient-level healthcare use. So a big shout-out, if you are a Rudy study participant, do complete your next set of questionnaires. You can email us or go to the website to find out more information. And hopefully next year we can present the patient-level data where we can find out how often people are using different parts of the NHS. Thank you very much.